Good morning, everyone. My name is, as Saeed mentioned, Philip, and I'm the Talent Acquisition Partner within MaineHealth. I specifically support our revenue cycle, our finance departments, and our IT departments. I wanted to touch upon a few talking points, and I'm happy to answer questions just after my statements. But for now, let me talk to you about what MaineHealth has to offer, and more importantly, our values for the community. At MaineHealth, our values are at the very core of living our mission and vision of working together so our communities are the healthiest in America. Wherever and whenever you interact with us, you can expect our team members to embody the following values in action. We are patient-centered. We focus on each individual's unique needs and partner with the people we care for, their families, and care teams to develop a shared plan. We offer respect. We embrace diversity and recognize the value of each person. We show integrity. We are honest, transparent, and ethical, and maintain a culture of trust and accountability. We are excellent. We set high standards and always strive to exceed expectations. We show ownership. We take responsibility for our actions, and we follow through on our commitments. Our approach to challenges are with optimism. We are innovative. We welcome diverse perspectives, embrace change, and are committed to lifelong learning. Now, I mentioned innovation as our last mission statement bullet point because of the whole COVID-19 crisis that we're all dealing with. COVID-19 has completely and drastically changed our clinical response and protocols, but all of MaineHealth staff has received daily updates from senior leaders within HR with full transparency. Our HR leadership jumped on the ability to help and support the vast network of 21,000 employees under the MaineHealth banner. When we began to understand the crisis that was the coronavirus, our HR leadership tasked our IT department to work 24/7 in order to get as many workers the ability to work remotely, allowing us to practice social distancing. Along with this emotional support as well as physical support, MaineHealth leadership provided both financial and childcare support on a weekly basis to those in need. In order to move forward successfully, HR placed our hiring into three separate pools, those being critical, business as usual, and what they wanted to call COVID-19 hold. These were the positions that required a specific set of training that we put a stopper in to better focus on our critical needs and what the general public needed from MaineHealth at the time. Now, when I mention this COVID-19 hold, it doesn't mean anyone within MaineHealth, any of the 21,000 employees lost any of their jobs, which to me is very impressive, considering what's happening across the entire globe. Hiring and jobs within MaineHealth moved forward and we adapted as we could. We changed all onboarding to virtual. We also changed our employee health screenings to phone screenings, so there wasn't that physical interaction. And we had more of an in-depth conversation surrounding the essential functions to each and every position we hire for. To elaborate on the positions that we do hire for, when most start talking about MaineHealth as an organization that owns and operates Maine Medical Center, Southern Maine Healthcare, MBH, Maine Behavioral Healthcare, Memorial Hospital, Stevens Memorial, Midcoast Hospital, Penn Bay, and all the others under the MaineHealth banner, we hire for every position that you can think of. I want you to picture everything that it takes to run a business and multiply this by 1,000 for every single position you're picturing. In order to successfully operate a not-for-profit such as MaineHealth, you need everything from your clinicals, your CNAs, your MAs, your RNs, your medical assistants, your physicians, your PSRs, your patient access associates, both front-facing, working with the clinical staff and behind the phones. We're talking schedulers, but also admins, payroll, supply chain, environmental services, security, analysts, medical coders, medical billers, cleaners, cooks, and everything in between. We hire every level position from entry level that has limited requirements all the way up to our president and CEO. Within MaineHealth, we offer vertical growth and tiered growth patterns, structured career ladders within specific departments, both clinical and non-clinical. An example of this would be a PSR or a patient service representative. This position has very few requirements to start and is also a three-tiered ladder, which allows you to gain so many different types of experience while being promoted from within the department and also promoted within the organization. Another great opportunity that I wanted to share with you would be that 40% of all of our hires are internal transfers, which means 40% of all positions are filled internally and with a promotion. Once you're in our not-for-profit organization, you're looking at a multitude of opportunities, and each department trains you for a chance that'll allow you to grow within more than just your own department. It'll allow you to grow personally, professionally, obtain skills that you never thought were possible, and that'll allow you to go to different departments within the organization, which, as I mentioned, 21,000 employees, a vast organization that allow a lot of different career opportunities. We also allow you to use those trainings you've received within each department to grow your career. As we all know, our passions change from year to year, from day to day, from time to time. And also another great piece of information is that your increased knowledge helps facilitate performance reviews and annual increases to your salary. Now, who doesn't love to be valued both personally and professionally? I know that I do. That's the reason that I made this switch and joined the MaineHealth team. I had hit my vertical limit within my past job, and I knew an organization as large as MaineHealth could give that to me. Now, if I'm going to be honest, I was afraid of one aspect of making the switch. I didn't want to be a number and not an individual. With how big MaineHealth is, you can see how I had that preconceived notion. I was wrong. I am appreciated by my entire department, no matter the level of position that who I'm talking with, whether I'm talking with a vice president or one of my own colleagues. I'm appreciated on a day-to-day basis. I have weekly check-ins with my manager who doesn't micromanage my work and trusts that I'll get everything on my desk done. My skill set has increased tenfold, and I feel that I'm a trusted partner. And I'm also a trusted part of what makes MaineHealth move forward. Now, I know that I've said a lot this morning, but I hope that you're already picturing yourself working within the MaineHealth family, or at least picturing a different career for yourself. And definitely with all that we've been going through with COVID-19 throughout the past month and a half, 2 months, I wanted to thank you all for listening. I hope that you're all healthy. I wish you and your families the best. And Saeed, I believe I'm ready to answer questions.
Fantastic. Philip, thank you very much for this great info session. And honestly, hearing what you've had to say about MaineHealth and the MaineHealth team, it would inspire me and many others to join your organization.